Hi, I'm Dave Warzel, and you're watching PHTV4 Spotlight. Today's Spotlight is on drug addiction and the stigmas associated with it. To take a look at this topic, we're talking with Karen White, who is a therapist at Safe Haven Counseling in Palos Heights. Karen, thank you for being here.
Thank you. Thanks for having me.
I don't know if people can tell, we're actually not at the office in Palos Heights. We're at the center in Southwest Highway in Palos Park. We're going to talk about why we're here, but before we do that, Karen, can you talk about what is your background? What degrees and licenses do you carry?
I have a master's degree in addiction studies. I am a certified alcohol and other drug abuse counselor, CADC. I went back to graduate school later in life, and I also have a master's degree in clinical mental health counseling. I am a licensed clinical professional counselor. And also have certification as a certified clinical trauma professional.
You have a lot of background, a lot of education
yes.
into this area. How long have you been with Safe Haven?
I've been with Safe Haven 3 years. I've been actually doing individual mental health counseling for about 4 years. The majority or bulk of my career is involving folks that have co-occurring disorders, addictions and or mental health disorders with the criminal justice system. I spent 24 years as a federal probation officer, and before that at the county level. So I have a lot of experience in the criminal justice field as it relates to people suffering from those issues.
Yeah, different perspectives coming at this.
Yes.
So how about the center part? What's the connection between yourself, the center, and Safe Haven?
I was working actually directly with the center initially, doing individual and group counseling here, and then when I started working for Ashley Fazekas, is the owner, proprietor of Safe Haven Counseling, I started working with her, and from that point, when she was supervising me directly while I was achieving full licensure and still required supervision at that point, I started working with her, for her, at the office, Safe Haven. And then I started, we have a loose contract, if you will, with the center. So I see, because I was the one that kind of started this, not project, but I was the one originally affiliated with working with the gentleman from the center. So I'm the one now with Safe Haven Counseling that gets referrals. Right. So gentlemen that are here in early recovery have the option. It's not mandatory, but it is provided that they participate or receive individual counseling, and they then do that with me either at the office, and generally initially it's at the office, and then future sessions are via telehealth.
Okay. All right. Thank you for sharing that background. Let's do the dive now. Are you ready? So we're talking about drug addiction, but even more specifically the stigmas associated with it, and then the impact that has on that person trying to get help or care in some way, what those stigmas are, what they look like, and how that affects that path to a better place. Yeah. Okay, so why don't we start there first? I mean, what are some of the stigmas or myths that are perpetuated out there about drug addicts or drug addiction?
Some of the stigmas that I've encountered or learned of throughout the years, especially given the track that I've come through, is that certain drugs are worse, than others, that only people from, lower socioeconomic areas, inner city people, that kind of thing, are the only ones addicted to things like heroin or crack cocaine, when in fact the opposite is, not necessarily the opposite is true, but you see addiction in the south suburbs, for instance. So it's not just people over here, it's just alcohol, or maybe, the lesser, what's commonly known as hard drugs versus less hard drugs, is that the stigma is that it's, it doesn't affect, folks on the higher end or in higher socioeconomic areas, that it is just, and the other one is that substance use disorders, formerly substance abuse or addiction, is now the umbrella is substance use disorders and mental health disorders. Is that it's a weakness, a lack of willpower, and that there's something must be inherently wrong with this person, and why can't you just stop? Misunderstanding or in ignorance, really, on behalf of many people in society.
Those are both very, I mean, powerful areas to move through. One is the idea that drug addiction doesn't know a socioeconomic border. It doesn't know a community border. It's anybody, anytime, anywhere.
Absolutely.
Right? And the idea that drug addiction as a disease as compared to a lack of control or, willpower or whatever, is a serious shift in thought for a lot of people, I think. And maybe we can talk about that next. Because of those stigmas or myths or false perceptions, how does that affect a person who is, let's say they're an addict, but they're on that path to a better place now. They're not active anymore in their addiction. How does it affect them, getting whether housing or healthcare or a job, those types of stigmas?
That's a multifaceted question. When I was thinking about that, reviewing some of this and thinking about that ahead of time, I couldn't help but remember some of my former experience. But even with individuals that I work with now, whether through the center or elsewhere, who have some kind of history of substance use disorder, that often has affected things like their health, their finances, employment record, whether they've been unable to maintain employment, so they have these gaps on their resume, and how do they handle that?
How do they explain? Yeah.
If they've had any time, if there's been any period of incarceration, hospitalizations, modalities of treatment that they've been away from, how do they explain those things without the concern or the worry that somehow that's going to be held against me? And of course, ADA, Americans with Disability Act, says that you can't do that. But for folks who are starting, they're in very early recovery and just trying to get back out there, those kinds of things will hinder not just those things in the factual part of it, but the stigma is that word again, or the shame and guilt that goes along with that person's going to look at them as, oh, you were just in treatment, or you were living at the center, and you're in this recovery program. Can I trust you? There's a lack of trust.
Well, and I'm thinking about, identifying addiction as a type of disease as compared to a lack of will or control. Listening you talk that way, we wouldn't listen to like a cancer patient or cancer, we wouldn't hear them and treat them the way we treat an addict, even though the parallel is there, right? The addict is dealing with a disease that they're overcoming, right? And then maybe we can kind of segue into the next part of this is, what, for you specifically and the addict, I'm imagining an addict who's aware of the stigmas, probably experiencing them, and for you as a counselor, when you finally do get a chance to talk to somebody, dealing with those stigmas that you're aware of out there and trying to help the addict, how does that affect you doing your job, or how does that affect the addict trying to get help then?
Some of the first things I mentioned, the two words a minute ago, is guilt and shame. Two things that are paramount, for people with substance use disorders. And in my experience, also as a mental health clinician, is that there's also a lot of trauma associated with many people who have substance use disorders. And so it's addressing those sometimes underlying issues, while the fact is that there may be a physical and disease component to it, that there's also a series of emotional or mental health or even cognitive behavioral kind of things associated with it that should be addressed, along with obviously abstinence, but sometimes that in and of itself is not enough, that it's more multifaceted.
And would you say that, like, when you first start to talk to somebody, you almost have to address the stigmas they've been dealing with so that they can move forward?
Absolutely.
Yeah.
And I ask the person that, because what is it for them? Because it's going to be different for everybody, whether it's somebody with children who's been estranged from their children because of their behavior while in active addiction, divorce, financial ruins, lack of employment, all those kinds of things are going to affect each person differently depending on where we came from and how it was affected.
Yeah. And the next part of this, I'd like to move in, we've identified a problem here, and we're labeling, drug addiction is recognized as a disease now. but the stigmas are still out there. The misperceptions are still out there. So what can we do to try and close the gap in that area, so that between the public perception and wherever that stigma shows up, and the addict, the person going through it individually, how do we eliminate that or close that so that they're not experiencing that?
I don't know if it can be eliminated altogether. Certainly the perceptions are always, perceptions and perspectives are always going to differ. There's always going to be barriers and people that don't necessarily believe that addiction is a disease. There's still many different beliefs held on that. The fact remains that there is evidence-based information about it. And for me as a clinician and with the group that I work with, the center here is about education and including family members, loved ones, persons associated within that person's life. Bring the family in. When I was here on site for a while, we had family meetings where we would have family members of the individuals that were residing here come in once a month or so, and we would just have a loose, conversation about things and what's going on here at the center, what to expect. I work with individuals, like couples, where one person's maybe coming out of treatment and the other person is not involved in addiction. So in any way that we can include the community, that we can educate the family, include them in the recovery process, because the reality is the individual's going through recovery at whatever stage, but so is the family or loved one. It's just a different set, and that's what I tell my clients is your spouse, your family, your children, they're also in recovery. They're at a different place, they're at a different stage, but you're changing, and because you change, the dynamic of this relationship is going to change, hopefully for the better. But you're going from this person who is actively drinking, actively using drug, not in their life, and now you want to come back in, and it takes time. It takes time to rebuild trust. It takes time to develop this new relationship, whatever that's going to look like. But if we can, in our field, in our practice, Ashley Physique is the owner. She's very involved with working with first responders, getting additional training on that, reaching out to police, fire, paramedics. She does some training with one of the local suburban paramedics departments, where she does training once a month. So any opportunity we have where we can go out, networking, meeting with other practices, educating, putting on workshops, any of those kinds of things we want to do to basically reach out and just provide awareness as well as education about addiction as well as mental health disorders.
It sounds like inclusion, we think of like, all right, well, the drug addict will go get help. But actually that drug addict has friends, they have family, hopefully employers, or, there's a group around them. The inclusion part seems that would go a long way, and obviously the education that goes with it towards, tamping down the stigma and helping people better understand what the person has experienced. Right?
Unfortunately, in many cases, the family, slash loved ones will say, okay, that's your problem. You're an addict, you need to go here, fix yourself, and then come back, when you're done, and come back and be that person when you're cured. And there's not a cure. It's an ongoing recovery process.
And the person has changed, like we all change all the time, I can see the education, the inclusion, the shared experience is what'll bring them together.
Very much.
I feel like we've covered a lot of ground here, but I want to make sure, is there any other advice that you would recommend for either people in addiction or family or friends of them, or the general public in general, how to be more, I don't want to just say sensitive, but aware of what this means and the impact of it? And I'm talking about the stigmas and the myths associated.
I love and am honored to be affiliated with the center, because this is one of very, very few places. When I've been to trainings and conferences and things and talk about the center, and this is a place where men can go after being in residential treatment, where they can stay long term. That's a huge missing component, and again, there aren't many places like this, but what's key, in my opinion, is that it takes a while. It takes a while to achieve some stability. It takes a while to start rebuilding
Right.
things, and that this is not a quick, unfortunately, it's insurance that dictates, 21 days, 28 days, however many days that they're going to pay for a program, and that's great at that builds a little bit of a foundation for the person to go out, but that's really just the very, very beginning part of it. Somebody leaves treatment and just out there like, okay, now I got to go back to work. It's very, very difficult.
Hey, you're talking about a life-changing experience here. It's not, you're not going to flip a switch and like, okay, go.
That's right.
Yeah, there's a process here, and it will take time, and I'm sure it varies to some degree, person to person. But Karen, thank you very much. I really appreciate
Thank you.
the information you shared. Very good. Wish you the best with your luck, your work at Safe Haven and
Thank
with
you
the
so much.
center. All right.
I appreciate it.
Thank you.
Have a great day.
I'm Dave Worslow. You've been watching PHTV4 Spotlight. Today, the Spotlight has been on drug addiction and the associated stigmas. We've been talking with Karen White, therapist at Safe Haven in Palos Heights. Thank you for watching.